Philippine Society of Public Health Physicians, President Dr. Michael Kaampued, Secretary General Dr. Alberto M. Ong Jr., organizers and honorable public health physicians and professionals, good afternoon. It is with great honor to have this opportunity to speak before you on behalf of the Commission on Human Rights of the Philippines to discuss health equity and human rights in public health. Human rights are rights we all have simply because we exist as human beings. These rights are universal and inherent to us all, regardless of nationality, ethnic origin, sex, religion, language, color, or any other status. They are inalienable, which means that no one can take away our rights except in specific situations and according to due process. Moreover, human rights are indivisible and interdependent, which means that the fulfillment of one right often depends wholly or in part upon the fulfillment of other rights, and the denial of one right invariably affects the enjoyment of other rights. These rights range from the most fundamental, which is the right to life, and to those rights that make life worth living. Among those rights that make life worth living is the right to health. The World Health Organization defines the right to health as the complete state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. To fulfill this right, the state should ensure both freedoms and entitlements. Freedoms relate to the right to control one's health and body, including sexual and reproductive freedom, and the freedom from interference such as torture, non-consensual medical treatment, and experimentation. Entitlements cover access to adequate healthcare facilities and services and appropriate state measures related to the socio-economic determinants of health, such as food, water, and sanitation, safe and healthy working conditions, housing, and poverty. From these, we start to understand that the right to health is interconnected with other human rights, such as the rights to life, food, water, housing, education, work, non-discrimination, privacy, access to information, prohibition against torture, and others. In the Philippine context, the right to health is enshrined in the 1987 Constitution. The Philippines is also a state party to the International Covenant on Economic, Social, and Cultural Rights, which mandates our government to ensure the right of everyone to the enjoyment of the highest attainable standard of physical and mental health. The UN Committee on Economic, Social, and Cultural Rights emphasized that in all forms and at all levels of the right to health, the following interrelated and essential elements shall be present. 1. Availability. States should ensure the provision of enough functioning public health and individual health care facilities, as well as safe water and sanitation facilities, trained and fairly paid medical professionals, and essential medicines. 2. Accessibility. Access to health involves four key elements. 1. Non-discrimination. 2. Physical accessibility. 3. Economic accessibility. And 4. Information accessibility. Number 3. Acceptability. Health facilities should be respectful of medical ethics and the culture of individuals and communities, as well as attentive to gender and life cycle requirements. And 4. Quality. Health facilities should be scientifically and medically appropriate and of good quality. Among other things, this requires the provision of necessary medicines and equipment, skilled medical professionals, and adequate water and sanitation. In sum, health as a human right creates a legal obligation on states to ensure access to timely, acceptable, and affordable health care of appropriate quality, as well as to providing for the underlying determinants of health, such as safe and potable water, sanitation, food, housing, health-related information and education, and gender equality. Gaps in health are persistent, and many of them are found at all levels of different societies. But health equity must ensure that everyone could attain their full health potential, and that social status or other socially determined circumstances should not prevent anyone from achieving it. It takes into account non-medical factors that influence health outcomes called social determinants of health. These social determinants have significant influence on health inequities. These affect a person's ability to earn a good living, to live and work in a safe and healthy environment, and effectively use available resources, including healthcare resources. In some cases, an entire specific group or population do not have equal access to quality education, housing, and other resources, which can lead to greater sickness and increased injuries and deaths, something that is totally preventable if only they were given access to good determinants of health. In other words, health equity means increasing opportunities for everyone, and most importantly, giving special attention to the needs of those at greatest risk of poor health based on social conditions so that they will be able to live the healthiest life possible, no matter who they are, where they live, or how much money they make. Human rights and health equity share the same fundamental values centered on equal dignity and worth of all human beings. We have seen in the past 70 years that human rights have been bringing the world together into a kind of public health cooperation we have not seen in the past. Public health actions used to be based on charity, but the framework of human rights sees all persons as rights holders, deserving of the highest attainable standard of health and living. However, there is still much to be done. Many are still prevented from enjoying the benefits of the right to adequate health and standard of living. For everyone to fully enjoy them, we have to address conditions that deny them the fulfillment of these rights. Nearly all conditions contributing to health inequity also affect other human rights. For instance, when a person is treated unfairly because of race, class, gender, sexual orientation, and other status, the unfair treatment can lead to poor education or fewer job opportunities. This result to economic disadvantage evident in the income disparity between college and non-college graduates. Income can determine the kind of neighborhood a person lives in. The environmental conditions of a neighborhood or community can affect a person's health. People who live in poorer areas generally have shorter lifespans than those in wealthier areas. Lower income neighborhoods tend to be poor in social and environmental conditions, such as proximity to environmental and health hazards, higher violence and crime rates, limited access to healthy food, among others. These deny people the chance to live a long and healthy life. By eliminating these barriers with the goal to achieve health equity, we also promote and protect human rights and dignity. The COVID-19 pandemic and other public health challenges underscore the importance of public health and demonstrate the fact that public health challenges are human rights concerns. The current pandemic is not just a health crisis, it has quickly ballooned into global human rights crisis after response measures by duty bearers have adverse effects to the enjoyment of civil, political, economic, social, and cultural rights, and disproportionately affecting the most marginalized, disadvantaged, and vulnerable members of society. A survey in May 2020 has shown that 9 in 10 Filipinos were stressed because of the pandemic. The same survey showed that at least 4.2 million families experienced involuntary hunger due to lack of food to eat. The unemployment rate in April 2020 during the implementation of strict quarantine measures was 17.6%, which translates to more than 7 million unemployed Filipinos at that point. The enrollment rate for the school year 2020 to 2021 was also lower at 88% compared to the previous school year. These numbers do not even come close to the whole picture, as countless others were either directly or indirectly affected by both the actual health crisis of the disease and the socio-economic effects of the various crisis response measures implemented by the government and the private sector. Amidst the public health challenges, it is good to be reminded by the values written in the Code of Conduct of Public Health Officers and the Code of Conduct and Ethical Standards for Public Officials and Employees, such as being humane, dedication to public service, upholding professional integrity, being just, being generous in spirit and deed, and exercising courage to protect the interests of public health. These values are essential in addressing health inequities. On top of these, and in pursuit of health equity, health organizations and professionals should continuously strive to provide culturally competent care to many different patient populations who need clinicians to understand their lives, address population specific healthcare needs, make practices inclusive, collect data in a non judgmental way, and build trusting relationships that enable them to openly participate in care improvement strategies that are driven by a commitment to health equity. Likewise, all levels within health systems should explicitly include health equity in strategic plans and goals. Given that health disparities are shaped by multiple determinants of health, achieving health equity requires engagement, not just with persons in healthcare, but also in education, transportation, housing, planning, and other industries and businesses. Indeed, achieving health equity is a community wide effort. Equity in health requires not only equitable access to healthcare, but also means working outside the healthcare system to address broader social well being and development. In closing, hats off to all of you for your dedication and for tirelessly working for public health and health equity. Our public health system will not work without you. I wish everyone safety and good health in the midst of the current pandemic. God bless us all. Mabuhay kayo. Thank you.